Good afternoon, good morning. It's nice to see you. I want to thank you for coming here to have this interview with me. My name is Jorge Reyes, and I'm a nurse practitioner in psychiatry. Would you like to tell me your name? Okay, and how old are you? And who was the one who referred you to this office? What do you think will be the best way to call you? Who are the person who come to you with you today? Okay. Um, do you agree that they stay here with us through the whole interview, or you prefer to be by yourself and then call them if we need to? That will be up to you because you are already older than 18 years old, so you can make that decision. To start the meeting, let me give you some guidelines to what is going to happen today. And let me start to say that most of the time I like to meet with the patients 1 or 2 times a week for the very first 3 or 4 weeks. Then depending on how they are doing, we can schedule an appointment once a week if we need to. If we need to. All the time we're going to meet here in this office at 4 p.m. If that works for you. Otherwise, we can agree to set up another schedule according to my schedule and also according to your schedule. The best way to contact me is 2 different ways, by email, or you can call to this office from Monday to Friday from 9 a.m. to 5 p.m. On weekends, you can email me, or you can use the voicemail that we have 24 hours, and I will try to answer all your questions within 6 hours or as soon as I be available. If I have some day off, that is rarely, but can happen, you will be seen by Dr. John D, who will provide you with all his contacts, so you can follow with him. You have to call 24 hours in front, so to cancel your visit. Would you bring you here today? For how long you have been having these thoughts and feelings? Is it the first time that you have been these feelings, or is something that has been happening to you before? When was the first time that you remember having all these feelings and thoughts? There is any issue that you can link to these feelings that occurred recently, or they just started suddenly? It's a big difference when you have some issues that you can link them to them. Do these feelings interfere with your daily activities? In what ways interferes? Does this feeling affect your personal life with other people, at work? Did you ever take any medications for these symptoms before? When that happened? Who prescribed those medications? How long were you taking those medications? Can you tell me the names of these medications? Have you ever been in the hospital because of these breakdowns that you have? For how long were you in the hospital? Now that I have some ideas of what bring you here, let me ask you some questions so I will have a better understanding of your background. Do you have any chronic disease in the past? Do you take any medication for this problem? Are you taking any medication right now? Who is your primary physician? Can I contact him if I need to? Can you give me his phone number so I can talk to him about these chronic diseases? Do you have any allergies or side effects from any medications in the past? Do you have any reaction to foods or any kind of substance in the past? If you have any difficulties to sleep, do you have any lack of interest? Do you have lack of appetite, lack of concentration, or lack of energy? Do you feel sometimes you feel that you have this elevated mood that includes be distracted, have some indiscretions with other people, have the feeling of have a grandiosity feelings? Do you have any flight of ideas? For example, you are talking about something and then suddenly you switch topics and then come back to that subject that you were talking before? Do you have any kind of problems to give your ideas or your thoughts to people? Do you drink alcohol? Do you take some drugs? Since when and how often do you have drinking or taking drugs? Do you have experienced any withdrawals in the past? Do you crave for alcohol or drugs? Do you have any social, familiar, or financial problems due to this addiction? What about, do you have any kind of palpitations, nauseas, shortness of breath, paresthesias, fear of dying, fear of dying? Do you shake sometimes, sweating, or you have some kind of a realization? That means that you feel that you are not you, and you think that you are another person. Are you afraid of being in closed spaces, like elevators or stadiums or where there's a lot of people? Do you wash your hands more than 5 times a day? Do you keep your house neat? Do you have any mental rituals to do certain things at certain moments? Do you constantly check what you do and you have to check it 3, 4 times in a row because you're not sure about what you just did? Have you ever experienced any trauma in the past? Do you have any flashbacks or nightmares? Or do you recall any kind of trauma? Do you have any irrational blaming for what happened in the past to you? Muscle tension, fatigue, or concentration problems? Have you lost weight in the last month? Are you afraid to be fat? Do you see any kind of change of body image distortion when you are seeing yourself in the mirror? Tell me with more details what's happened to you, how your problem starts, and when does it start. Can you be more specific about what you just told me? What your parents has to do with this problem? Are you keep seeing that lady, your girlfriend or ex-girlfriend? Have you tried to contact her before? How this relationship change your life, your daily activities? Do you think that because of this problem with your girlfriend, everything has going downhill? Do you think it's possible for you to tell me when you start to drink? Did you drink before? How much you were drinking before? Do you use drugs when you drink? Does your ex-girlfriend used to drink or use drugs? Do you think that she is the reason why you are doing what you are drinking more than before? How often you were drinking with her? Do you think that you can stay sober for the next 8 days? How do you sleep? You're waking up in the morning 2-3 times during the morning hours? At what time? Have you ever watched the clock? 2 or 4 in the morning? What do you like to do? Do you still playing bowling with your friends? Not anymore. And you don't have the desire to go to play. Do they invite you to go by yourself? Or you don't have the energy to go? Okay. How are you doing at work? Or you're having some days off? But this patient has been having these brief episodes of depression maybe 3 times in his lifetime, having depression for the last 2 years. So he went to see a doctor who prescribed him some medications, but he doesn't remember the name of them. And now he had this problem due to the breakdown of his girlfriend that he has been living with her for the last 5 years. We find out that he cheated on him, and that made him to go back to his house with his parents to live with them. I will have to see him maybe twice, 2 times a week for the very first 3 weeks, so I can follow up with the medications and how he's taking the medication and how the medication has been helping him. I'm going to give him some handouts about what to expect from the medications, what will be the benefits, and also what will be some other effects that he might experience by taking these medications. He agrees to take medications, and I'm going to start with one medication to see how it works. And he agreed with it. Also, I will recommend him, if he is agreed to do some physical sports, physical activity, like going to the gym 3 times a week. Something that he had been thinking to do it, but now maybe it will be the chance to do it. I will help him. And also he will try to go to work every day, and to give him some information about what is depression and how he can fight with it, besides taking the medications. So at the end, he agreed to the plan. He will come back in 4 days from now. Today's Monday, he will come back on Friday. So we'll see how it goes. So thank you for coming, and I hope to see you in 4 days.